When you buy an iPhone 13 in France, it comes shipped to you in the box with earpods. That's in order to have a hands-free kit so that you can keep the cell phone away from your head and especially your child's head. So France has much stronger laws in relation to cell phone and cell tower radiation. They're not perfect, but they're light years ahead of the United States. They also have in France, along with Belgium and French Polynesia, a ban on making advertisements aimed at children for cell phones, a ban on the sale of cell phones designed for young children. But in the United States, cell phones are heavily marketed to children with games and apps that delight them. And commercials feature kids with phones all the time. I mean, just go down a grocery aisle, and of course, you'll see children watching streaming videos in grocery carts, and parents who love their kids are completely unaware that their child is absorbing much higher levels of cell phone radiation from having it that close to them, clutched in their lap. Sometimes the scandal is not what is illegal in a country, but rather what is perfectly legal and being allowed according to laws which are not accountable to the people and to children and to public health and to the environment. That is the case of cell phone and wireless radiation in the United States. It's shocking, but did you know that there has been no robust review by any health and safety agency of all of the science on cell phone and wireless radiation from phones, from towers, from smart speakers, from Bluetooth, from Wi-Fi, from your wireless mouse? There has been no robust review of all of the science. There's been no reports. The EPA has not looked at, well, how are birds going to be affected from all of these cell towers with 5G? How are bees going to be affected? Let's look at the science and come up with our determination of whether it's safe or not. That has simply never been done. Did you know that when cell phones are in body contact, that the cell phone radiation exposure could be up to 11 times our US FCC limits, what is allowed? And yet, phones aren't even tested touching the body. Instead, they're tested with a distance between the phone and the body. But we're all using phones right up against our bodies. Our teenagers, our children are sleeping with phones underneath their heads. Adults are as well. And yet, they are not being informed that the phone is not even tested in that way. And when it is, as the government of France did, when they tested phones at body contact, they found that the regulatory limits were violated. I am so thankful that in August of 2021, the US Court of Appeals for the DC Circuit ruled in our landmark and historic lawsuit against the Federal Communications Commission that they had violated the law in making a decision to allow our 1996 rules about human exposure and rules about how cell phones are tested, that they had violated the law in deciding that those rules did not need to be updated. They actually had a large record over many years, which had accumulated to over 10,000 pages of evidence documenting harm at low levels, at legally allowed levels, people who've been injured, people who are getting sick from this radiation, and studies on animals and on humans that has found effects. And yet, no US health and agents, no US health agency actually even reviewed that record. This court decision in Environmental Health Trust et al. Versus the FCC is critically important because what it does is take the covers off what has been going on at the federal level in relationship with cell phone and wireless radiation, which is, well, almost nothing. We need to change that. We need to strengthen protections, legal protections for our children, for wildlife, for trees, for the natural environment. We need to change laws at the federal level, at the state level, and at the local level to protect people and the environment. This court ruling confirms that FCC compliance does not equal safety, at least if what you think of as safety is that all of the science has been looked at and that it has been shown to be safe, and that experts who are medical and biologically based and public health experts have taken a look at the science and made a reasoned decision about whether the science shows harm or not. because that's never been done in the United States for 25 years. For 25 years, we have had laws in this country. And not only that, but the laws that we have, which are based on outdated science, never included children. They didn't include an assessment of how they're more vulnerable because of their developing brains and bodies, or about what it might mean because they're going to be exposed for a lifetime. So what's next is that the court has remanded it back to the FCC. That means that they need to respond. They need to show that they have looked at this information and that they have had those with expertise, because the FCC is not a health and science agency. So they need to show how this issue has been fully addressed and make a decision based on solid reasoning and a robust look at what is on the record. Now, the court specifically asked the FCC to make a determination as to whether the evidence warrants a change to the 1996 limits, and wanted them to speak specifically about children's vulnerability, about long-term exposure, about environmental impacts, about the new technological developments and the ubiquity of wireless, because of course we have it everywhere, and what will that mean in terms of safety determinations, and also how the FCC's cell phone and wireless device testing regimens allow a space between the phone and the body. And of course, why are they based on heating? They actually are temperature based. And yet what the evidence showed in our case is all of these effects that are not actually linked to temperature, but are not heating effects. They're called non-thermal or heating effects. So the FCC has a job to do, and we, the people, now need to let our elected officials know about this. We need to inform them at every level of government. We need to tell them about the court case, and also to have them act, because we really can't wait. It could take years for the FCC to take action on this. We need action now. We need protections, especially at the state and local level now, so that cell towers are not located right in front of our bedroom window, so that when our children are handed cell phones, they are aware of how to turn it onto airplane mode, how to turn off all of those antennas. The devices need to be kept on a table so that our schools and community spaces have safe technology, not technology which exposes them to wireless radiation, which is known and considered by many scientists to be a carcinogen, to have impacts in science linked to impacts to the brain, to the nervous system, to reproduction, sperm damage. There's studies showing impacts to the ovaries. In animals, there's studies that have found developmental changes in humans actually during pregnancy. And we need protections, and we need to have them now. So thank you for supporting Environmental Health Trust. Please learn more at ehtrust.org.